Hello, and welcome back to Damal Consult Career Academy, your trusted guide for career success in healthcare and beyond. Are you preparing for an NHS doctor interview in 2025? Want to know exactly what to expect and how to impress the panel? In today's video, we're diving into the most common NHS doctor interview questions and breaking down how to answer each one with clarity and confidence. Whether you're a junior doctor, a national medical graduate, or applying for a specialty role, this video will give you the edge you need to succeed. Let's get started. 1. Why do you want to work for the NHS? I want to work for the NHS because it represents one of the most respected and inclusive healthcare systems in the world. I deeply admire its core values, especially the commitment to providing care based on need, rather than the ability to pay. As a doctor, I'm drawn to the NHS's emphasis on teamwork, equality, and putting patients at the heart of everything. I also appreciate the opportunities for continuous professional development and working in a diverse, multidisciplinary environment. Being part of an organization that delivers high-quality, evidence-based care, while also focusing on compassion and respect, aligns perfectly with my personal and professional values. 2. Can you tell us about a time you dealt with a difficult patient? Yes. During my foundation year placement in a busy A&E department, I encountered a patient who was very agitated and verbally aggressive. He had been waiting several hours and felt ignored. He was shouting at staff and refusing any further assessment, which created tension in the department and concern among other patients. As the attending junior doctor, I was responsible for ensuring he received care while also maintaining a safe and calm environment. I approached him calmly, introduced myself, and acknowledged his frustration. I listened without interrupting, which helped de-escalate the situation. I then explained clearly what had caused the delay and what we would do next. I reassured him that his concerns were valid and that his case was now a priority. He calmed down, allowed the examination to proceed, and even thanked the team later for taking the time to listen. It was a valuable reminder of the power of empathy, communication, and staying professional under pressure. 3. How do you handle stress and maintain resilience in high-pressure situations? As a doctor, I understand that stress is an inherent part of the role, especially in high-pressure environments like the NHS. To manage it effectively, I focus on staying calm, prioritizing tasks, and maintaining a structured approach to my work. For example, during my foundation year, I was once covering a busy medical ward when several patients deteriorated at once. I paused to assess the urgency of each case, delegated appropriately to the team, and used SPAR to communicate clearly with the on-call consultant. This helped manage the situation efficiently while keeping patient care safe. Outside of work, I stay resilient by practicing mindfulness, exercising regularly, and maintaining a strong support network. I also engage in reflective practice and clinical supervision to process challenging experiences and continuously improve. Ultimately, I believe resilience isn't just about coping, it's about adapting, learning, and continuing to provide compassionate care under pressure. Before we proceed further in this video, I got something really important to share with you, especially if you're preparing for an NHS doctor interview. We've created a powerful resource just for you, the 50 NHS Doctor Interview Questions and Answers ebook. It's carefully designed to help you prepare effectively, boost your confidence, and give you the edge you need to pass your interview. Whether you're applying for a foundation role, specialty training, or a consultant position, this ebook covers the key questions you're most likely to be asked, along with professionally crafted answers to guide your preparation. And the best part? It's very affordable, and right now, it's available at 70% off for a limited time only. Get it today for 70% off. For this week only, the first 20 people to download will get the ebook at an exclusive 70% discount. Click the sealer or fourth wall link in the description box of this video to download your copy instantly. You can also visit sealer Go directly using the link provided or simply click the fourth wall link. It's quick and easy. Still have questions? Our online customer care team is ready to assist you. Chat with us anytime on WhatsApp or send an email. Don't wait until the last minute to get your copy today and walk into your NHS doctor interview fully prepared and confident. Now, let's get back to the video. 4. Describe a situation where you worked effectively as part of a multidisciplinary team. During my foundation year, I was involved in the care of an elderly patient admitted with sepsis and multiple comorbidities. The patient had complex needs, including diabetes, mobility issues, and early signs of delirium, which required close coordination across several departments. My responsibility was to help stabilize her condition, ensure timely medical interventions, and keep both the family and the wider care team informed. I collaborated with nurses, physiotherapists, a dietitian, the discharge planning team, and a geriatrician. I made sure updates were shared during ward rounds and contributed actively in multidisciplinary team meetings to keep everyone aligned on the care plan. I also clarified the patient's medication list with the pharmacist and discussed mental capacity concerns with the geriatrician to ensure appropriate support. As a result of our joint efforts, the patient's condition stabilized. She regained mobility with physiotherapy support and was eventually discharged with the comprehensive care package. The family appreciated the well-coordinated care, and the case was later used in a departmental teaching session as an example of effective multidisciplinary teamwork. This experience really reinforced for me how vital communication and collaboration are in delivering safe, holistic care. 5. How do you ensure patient safety and maintain high standards of care? As a doctor, patient safety is my top priority and is central to every clinical decision I make. I ensure patient safety and high standards of care through a combination of evidence-based practice, clear communication, and adherence to clinical guidelines and protocols. I always take time to confirm patient identity and allergies, double-check medications, and involve patients in decisions about their care. I maintain clear and timely documentation, which reduces the risk of errors and improves continuity of care across the team. I also work closely with the multidisciplinary team, valuing every member's input and raising concerns early when I identify potential risks. I regularly reflect on my practice, attend CPD sessions, and participate in audits to identify areas for improvement. By combining vigilance, continuous learning, and collaborative practice, I contribute to a culture of safety and excellence in patient care. 6. Tell us about a clinical decision you made that had a significant impact. During my foundation year, I was part of a team caring for an elderly patient admitted with pneumonia. Initially, the patient was started on standard antibiotics, but within 24 hours, their condition began to deteriorate. I noticed the patient developed confusion, low blood pressure, and an increased respiratory rate, which raised concerns for sepsis. As the junior doctor on call, it was my responsibility to escalate concerns and ensure urgent care was provided. I reviewed the patient's NEWS2 score, which had significantly increased, and immediately informed the senior registrar. I recommended starting broad-spectrum intravenous antibiotics, administering fluids, and transferring the patient to a higher level of monitoring. I also arranged for blood cultures and a repeat chest X-ray to better understand the infection's progression. Thanks to this early intervention and escalation, the patient was moved to the high-dependency unit and responded well to treatment, eventually making a full recovery within a few days. This experience highlighted for me the importance of being vigilant, acting promptly, and collaborating closely with the team to prevent clinical deterioration. It showed me that even junior doctors can make decisions that significantly impact patient outcomes when they apply clinical reasoning and communicate effectively. 7. How do you handle a mistake you've made in a clinical setting? Handling mistakes with honesty, responsibility, and a focus on learning is essential in clinical practice. If I realize I've made a mistake, my first step is to immediately assess the situation, to understand its impact on the patient's safety and well-being. I then promptly inform the appropriate senior colleague or supervisor and the patient if necessary, ensuring transparency. Next, I work with the team to correct the mistake or mitigate any harm caused. After addressing the immediate issue, I reflect on what went wrong and why, so I can learn from the experience and put measures in place to prevent it from happening again. I also welcome feedback and participate actively in any clinical governance or learning forums to improve my practice. Ultimately, I leave that acknowledging mistakes openly and using them as learning opportunities is key to providing safe, high-quality care in the NHS. 8. What do you understand about clinical governance and its importance? Clinical governance is a framework through which healthcare organizations are accountable for continuously improving the quality of their services and safeguarding high standards of care. It involves a systematic approach to maintaining and improving patient safety, clinical effectiveness, and patient experience. The importance of clinical governance lies in its role in ensuring that patients receive safe, effective, and patient-centered care. It encourages transparency, accountability, and learning from mistakes, which helps prevent errors and improves outcomes. As a doctor, understanding and actively participating in clinical governance means I am committed to upholding professional standards, engaging in audit and quality improvement activities, and promoting a culture of continuous learning and patient safety within the NHS. 9. How do you stay up to date with medical knowledge and developments? Staying current with medical knowledge is essential to providing the best patient care. I keep myself updated through a combination of approaches. First, I regularly read reputable medical journals such as the BMJ and the Lancet to stay informed about the latest research and clinical guidelines. I also participate in continuing professional development (CPD) activities, including attending workshops, conferences, and online courses relevant to my specialty. Additionally, I engage with clinical networks and multidisciplinary team meetings where new practices and cases are discussed. Lastly, I use trusted digital platforms and apps, such as NICE Guidelines and UpToDate, to quickly access evidence-based information when needed. This multifaceted approach ensures that my knowledge remains current and that I can apply the latest evidence to improve patient outcomes. 10. What are the NHS core values, and how do you demonstrate them in your practice? The NHS core values outlined in the NHS Constitution and guide everything the service does. They include working together for patients, putting patients first in all decisions and actions, respect and dignity, treating everyone with kindness, valuing their individuality and needs, commitment to quality of care, delivering the highest standard of care to improve patient outcomes, compassion, showing empathy and understanding to patients and their families, improving lives, striving to make a positive difference to people's health and well-being. Everyone counts, ensuring fairness and equality so that no one is excluded or left behind. In my practice as an NHS doctor, I embody these values daily. I always put patients at the center of my care. By listening attentively and respecting their views and choices, ensuring they feel heard and valued. I work closely with my colleagues across disciplines to deliver seamless and safe care, recognizing that teamwork improves patient outcomes. I'm committed to continuously updating my clinical knowledge and skills, so I provide care based on the best evidence and standards. Compassion guides me in responding not just to physical health needs, but also emotional and psychological support. Finally, I treat every patient equally and fairly, recognizing and respecting cultural, social, and personal differences to ensure inclusive care for all. By actively demonstrating these core values, I contribute positively to the NHS's mission to provide high-quality, compassionate care for everyone. Do you have any question for us? Yes, thank you for the opportunity. I do have a few questions. Could you please tell me more about the team I would be working with and how multidisciplinary collaboration is encouraged here? How does this trust support ongoing professional development and training for doctors? What are the current priorities or challenges the department is focusing on, and how could I contribute to addressing them? How is feedback typically given to doctors here, and what kind of support is available to help improve clinical practice? I'm keen to understand how I can best fit into the team and contribute to delivering excellent patient care. Thanks for watching. Now, you're equipped with the top NHS doctor interview questions and smart strategies to answer them. Remember, preparation, structure, and showcasing your values aligned with the NHS are key to standing out. If you found this video helpful, don't forget to like, subscribe, and share it with fellow doctors preparing for interviews. And let us know in the comments which role you're applying for. We might cover it in our next video. Good luck on your NHS journey. You've got this.